Hello, ladies and gentlemen. Welcome back to another episode of America's Underground Voice. I'm your host, James Larger, and today we're going to be talking about healthcare and what the healthcare market should be like to ensure everyone has health insurance and can afford it. Alright, so today we're going to be talking about healthcare, and before I get started on that, I just want to say the reason why I haven't been making videos lately. I had a rough fall semester, so I had to regain some confidence in my classes and I just had to take the spring semester out making videos. I was just way too busy, and now we're here in the summer, so I'll start making videos more often on recent events and stuff like that. Um, but I have been paying attention to politics over the past 6 months, obviously, ranging from the Comey testimony to you got what else you got? Comey testimony. You got the Russia investigation. You got, well, just now recently, Bernie Sanders and his wife getting probed by the FBI. You got the Obama wiretapping ordeal, all that, and I'll be getting into that in my next videos. But today we're going to be talking about healthcare, and some people say that healthcare is one of those things that you can't truly get right. It's always going to be different for someone else's view. And I'm here to tell you today that government run healthcare is absolutely the wrong way to go about this. Because here's the thing, I'll use an example of bread. So let's say um, we have three different types of white bread, okay? The white bread all have competition because they all want to sell to the consumer their loaves of white bread. Now, how do they go about getting sales? Well, if there's more types of white bread on the market, the price goes down because of the fact that they're all trying to compete with each other to sell you their slice of bread. So, how does this relate to the healthcare industry? Now, instead of having one healthcare distributor, the government, imagine this for the bread analogy. Let's say we had this white bread, right? And then you only have one company distributing white bread. They can mess with the prices so much because they know that you have to buy the white bread. Okay? Same thing with health insurance. If it's run by one person, the prices are going to go up because there's only one person doing it. Okay? So the way you beat this, which to digress, is why we've seen Obamacare go so far down and why premiums have gone through the roof. Because they try to make it affordable, but they can't make it affordable because someone's got to pay for it eventually. So the higher end people making like 86,000 and above, have to pay higher premiums for the lower people on Medicaid. So that's obviously not good. So that's how you fix it. You bring competition back. So if the healthcare industry went back to what it was, and there was competition where you have Aetna, Blue Cross Blue Shield, all these different companies, and they're all trying to sell you health insurance, the prices are going to go down because they want to sell you it. Um, and it's also, they also let you tailor your own health insurance package. See, as a 20-year-old male, why should I have to pay for a gynecologist and pap smears in a government-run health industry when I can get my own package for however much I need to pay from somewhere cheap? That's how you make health insurance affordable. If you give it back to the private sector, that's how it's going to explode because the more people coming into the health insurance market, the lower prices go because there's more competition. Okay, so over the past um, over the past 6 months, I've been reading this book, Mark Levin, Plunder and Deceit, big government's exploitation of young people in the future. And if I was to make a book recommendation, ladies and gentlemen, I would definitely go and say, check out this book. Mark Levin is one of the smartest guys out there. He worked as a assistant attorney general or assistant chief of staff. I'm sorry, assistant chief of staff to Edwin Meese of Ronald Reagan's administration. He's on the radio a lot. But I wanted to share with you a couple stats that he has here on healthcare. And I don't know if you guys saw my video on Social Security, but I'm going to link that down below on Social Security. Um, But this also factors into Social Security. The Congressional Budget Office long-term budget projections using a baseline of current spending concludes that by 2039, federal spending for Social Security and the country's major healthcare programs, Medicare, Medicaid, CHIP, Children's Health Insurance Program, and Obamacare, will grow to 14% of GDP. That is twice the average over the past 40 years. Now, where am I going with this? That's insane. 14% of the GDP over the past 40 years. Now, we're funding these two government programs that are both going broke because of the way they were set up. Obamacare, a major health program, is the driving force of why it's going broke. And also, Medicaid, they expanded the requirements on Medicaid, so you have almost 9 million more people have been added to Medicaid. Because right here it says, this is all from the Congressional Budget Office. You can all look this up. Since there was an expansion, and the expansion went into effect, 9.1 million people have been added to Medicaid. 9.1 million. That's insane. It's one of these things where how long can it go on before it busts? Which is why we're seeing Obamacare the way it is. Obamacare has raised premiums for people because there's no money coming back in. Okay? So you see where I'm going with this. Again, the CBO has declared that the size and growth of the federal debt, most of which is owing to unfunded entitlement liabilities, especially Medicare and Social Security, is a threat to the future viability of the nation. Now, here's the thing. If we're going by this, what the CBO, Congressional Budget Office, has said, with Medicare, we're focusing only on Medicare on this video. If we take Medicare and we just give the health insurance, we give healthcare back to the private industry, we no longer have to care about Medicare. I'm not saying to completely get rid of Medicare, but I'm saying it needs to be cut drastically to where only people who need it, like who are like, you know, if you take that Medicare, then you only have to worry about Social Security, and Social Security is obviously its own other animal, but that stops increasing the debt. Okay, so that's where I'm going with this. So, long story short, to reiterate, government-run healthcare is costing this country a fortune. Okay, and the way you stop that is you give it back to the private industry, you give it back to free market capitalism, and you just cut it loose with healthcare insurance companies. That way, there's more competition. It drives down costs. It drives down costs. Health insurance does not have to be as expensive as it is. But since there's such a stranglehold on these health insurance companies, and there's so many that are going out of business, prices go up. And it's the same thing with Obamacare. The prices are going up because no one is paying for it. There's one last remark I want to make, because people want to use this as a excuse, not an excuse, but a driving force for why we should have Obamacare and why it should be even more expanded. Here's the problem. Okay, people try and talk about pre-existing conditions and how pre-existing conditions are the reason why there needs to be government-run healthcare. Here's the problem. Okay, here's what people do. People take advantage of this, and they don't want to pay for health insurance, so they wait until they pay through the pocket whenever they go to the doctor, and they don't invest in health insurance before they're sick. So then they end up getting a really horrible disease. And then they try and go to a health insurance company and say, hey, I need health insurance. And they say, no, we're not giving you health insurance because you have a pre-existing condition. And here's why this is bad, because if everyone did that, these health insurance companies would go broke. You have to pay your fair share into it. And people say, well, what happens if they can't afford it? Well, this factors into the private sector because they should have been able to afford it from competition. Okay? See where I'm going with this? Because the prices would have been so low from competition that they would have been able to afford it. And they wouldn't have ran into the issue of not being able to afford it, which there's only a slim amount of people that can afford it, that can't not afford it, and they just hold off on buying it. So that's how that's one of the driving forces. They say pre-existing conditions. It's mean if you don't take someone with pre-existing conditions. It's like, no, It's because you had to pay into the system, you had to pay into the company to get the rewards before you get sick. You don't not pay car insurance and then go out and get in a car accident and then go to a car insurance company and say, "Hey, I want car insurance." "Oh, but your car's totaled." "Oh, well, I need it fixed." It doesn't work like that. And it's the same thing with health insurance. I mean, that's how it is. Okay, so that's it, guys. Comment, rate, and subscribe. Tell me what you think about this whole healthcare ordeal. I'll be going into this healthcare bill that's going through the Senate. I'll be going through it probably in my next video, which will probably be released by the end of this week. So stay tuned for that, and comment, rate, and subscribe. Thanks for watching, guys.